Morning, everybody. So as you can see, it is absolutely snowy here in Bend, Oregon. I'm Burke from Focus Physical Therapy, physical therapist and the owner of Focus PT Sports Performance Clinic here in Bend. And today we're going to talk about hamstring rehabilitation. This is the first of a number of videos we're going to do on this subject. And in today's video, we're going to talk about acute management of this within the first few days. I'm going to tell you about the anatomy of this muscle, the biomechanics and function of it. We're going to interview some folks about it, and we're going to show you exactly what to do in these first few phases. After that, we'll be releasing videos that'll walk you through the next stages of rehabilitation. I'm really excited to share this with you. I hope you enjoy it. If that's what you need, then you've come to the right place. So stick around. Let's get to it. I am just heading up to the Summit High School practice field to check out the conditions. It's pretty snowy right here in Bend. And we will not be expecting outdoor soccer practice. So it's actually a perfect time to talk about hamstring rehabilitation. So let's head up there. We'll take a look at the field, and then we'll head into our recharge clinic, and we'll get you guys started on some hamstring rehabilitation. So stick around. Okay, we're here at Recharge, site of our sports performance clinic. And let's see who's here. Brooke, can you tell everybody who you are and what you're doing here?
Yeah, so I'm a student physical therapist. I'm here working with Focus Physical Therapy for 3 months on my final clinical rotation before I graduate from school.
Awesome. Well, Brooke, it's been a pleasure to have you.
Yeah, thanks.
So Brooke's been helping us out with this series on hamstring rehab.
So the hamstring are typically a little bit more postural muscles that are on the back of the thigh. You see a lot of injuries with those muscles with people who are doing sprinting type like workouts, a lot of fast cutting drills, that kind of thing, but also people who have sort of an imbalance between their glute muscles and the hamstring muscles. Those kind of have to work together to create a nice balance as you're walking, running, doing all of your normal outdoor activities.
Awesome. Totally agreed. And you're quite an athlete yourself as well. Mm-hmm. Have you ever hurt your hamstring?
Fortunately, I haven't, but I've struggled with tightness and kind of fighting the battle with my experience being a triple jumper in track, having to keep my hamstrings lengthened to the point where, I'm not worried about doing a quick motion and having them get an injury, but at the same time keeping them powerful and tight for those dynamic jumps. Hamstrings are, you take them for granted, just with your daily activities, but like doing more hamstring focused exercises can really help you tease out like where you have weakness and how you can make your body a little bit more well-rounded for, keeping up in your sports.
And is there one thing that's been a take home for you that you're going to start to do so far based on what we've done?
Yeah, definitely stretching. Like keeping like a good maintenance stretching program would be the way to keep your body healthy.
Yeah, you and probably everybody else. Well, Brooke, thanks so much for your help with this series.
Yeah.
You guys are going to see a lot more of Brooke. She's going to demonstrate a lot of the moves for you and the exercises. So I really appreciate your help. It's been great having you.
Yeah.
And we'll see you guys next time.
Thanks, everybody.
So at this point, the gym was getting pretty loud. So I'm switching to voiceover mode now, and we'll continue with that through the rest of this video. The hamstrings are a group of 3 muscles on the back of the thigh. Semimembranosus and semitendinosus are 2 individual muscles that make up the bulk of the hamstrings to the inside half of the muscle group, while the biceps femoris occupies the outer part, and it has 2 muscular heads. The upper attachments of this muscle originate on the sitting bone or the ischia of the pelvis, and the lower attachments insert into the tibia below the knee. Because this muscle group crosses two very important joints in the lower part of the body, it has a very, very necessary motor control and postural function, and regulates or controls the relative motion between those two joints. It will be strongest in the middle ranges of that motion and progressively weak as you get towards the limits of its travel, either lengthening or fully shortening. These are the points where this muscle group is most prone to injury. The hamstring muscle delivers power, speed, and quickness to the legs. It contracts or lengthens appropriately to keep the best strength relationship between the hips and the knees. If a direct blow occurs, or an overly forceful contraction, especially while the muscle is lengthening, an injury can occur. In the hamstring muscle, the myotendinous junction, where the muscle meets the tendon, is the most vulnerable site to injury. A grade 1 strain is the mildest form of muscle injury. Some fibers are torn, there'll be swelling and pain, but on imaging, the fibers will look mostly intact, and the damage is more on a microscopic level. A grade 2 muscle tear is a more serious tear, and imaging will show torn muscle fibers. Finally, a grade 3 muscle tear is the most serious injury to a muscle, with a complete rupture of that muscle. Now that you understand a little bit of the anatomy and function of the hamstring muscle group, let's take a look at the first few days after an injury occurs. From the time of injury through the first 3 to 5 days, the most important goal is to prevent further injury or re-injury. Additional goals during this phase include managing any pain or inflammation and swelling. Here's what you need to do. PRICE stands for protection, rest, ice, compression, and elevation. Protection simply means avoid overstretching or overcontracting the muscle. Avoid strenuous exercise at this stage, but keep good range of motion and neuromuscular control by doing exercises like standing on one leg for balance for 30 to 60 seconds at a time. Apply ice to that muscle at the site of injury for 15 to 20 minutes at a time, approximately every 3 to 4 hours, or as needed for pain. An ACE wrap around the muscle can help reduce pain and swelling, and if the injury is a result of a blow or trauma, using kinesiology tape can be very, very useful for reducing that more superficial swelling. Well, that is it for stage 1. And it really is pretty simple in this acute stage, these first few days. If I had to summarize, I would say, don't mess it up. You can set yourself back seriously by overstretching your hamstring at this point, so be very, very careful. In my next video, I'll be showing you the regenerative phase of hamstring rehabilitation, so be sure and come back and take a look at that video. This is the stage where we'll be introducing the exercises and movements your body needs to lay down new tissue and create a strong and flexible scar. So thanks so much for watching this first video on acute care management of hamstring tears. To recap, first 3 to 5 days, you're going to want to ice regularly for 15 to 20 minutes every 2 or 3 hours, but protect your skin. Keep it wrapped, keep some compression on it with an ACE wrap and some kinesiology tape. And active recovery, so no stretching, 100% no stretching of this, but movement is okay. Easy walks, easy cycling if it's not an upper hamstring injury, and keep the blood flow going. Our goal, let those tissues heal so we can get on to the next phase. So stay tuned for our next video. Hit like and subscribe, and leave any comments and questions in the comments section below. Thanks so much for watching. From me and all of us here at Focus Physical Therapy, Hope to see you next time.